Dr. Raja sir has come.
Yes, I'm here. I'm here.
Yes, sir. Dr. C. N. Raja.
No, I don't see ma'am. Maybe you should call him, ma'am.
Yeah, I'll call him.
Chockalingam sir, Dr. Chockalingam sir has joined.
Okay.
Is he coming? I don't see. Yeah.
Gopi has joined. எல்லாம் இருக்காங்க Zoomல. மூஞ்சி
Welcome,
காமிக்கல.
sir.
இந்த பார் சொக்கலிங்கம்.
Welcome, sir.
அவங்க பொண்ணு பேசுதுல.
Hello. Hello, Pa. Good evening. Mute la இருக்கீங்க.
Sir, you're on mute. No, you have to go unmute, sir.
பணம் எப்படி இருக்கீங்கம்மா எல்லாரும்?
Fine, sir.
உங்க பேர் மறந்துட்டேனே.
I'm Rotarian Suguna, sir. I'm not a doctor.
ரொம்ப வாழ்த்துக்கள். ரொம்ப அருமையானது. ரொம்ப அருமையா பண்ணிட்டு இருக்கேம்மா சுகுணா. எங்க ஜமுனா எங்க?
There, sir. She's there. Jamuna, ma'am.
எப்படி இருக்கீங்க ஜமுனா?
அவங்க freeze ஆயிட்டாங்க. There. She's coming back again. Jamuna, ma'am, sir is talking to you. Jamuna, ma'am, can you hear?
நல்லா இருக்கீங்களா ஜமுனா?
Good evening,
Very
sir.
good.
Good evening.
Good evening. How are you? I'm Mrs. Chockalingam.
Good evening, madam. Good evening.
Good evening.
எல்லாம் ரொம்ப கொரோனால கூட இவ்வளவு அருமையா பண்ணிட்டு இருக்கீங்க. ரொம்ப ரொம்ப மகிழ்ச்சி. பிரியா நல்லா பண்ணுமா?
Yes, of course. ரொம்ப எஃபர்ட்ஸ் எடுத்து பண்றாங்க.
அடேப்பா. எங்க பிரதீப் வந்துட்டாரா?
வந்துட்டாரு. I saw him.
Sir, vantara.
Very good.
Good evening, sir. Good evening. Good evening, sir.
Hello, sir.
Sir.
Thank you, sir. Thank you.
Hello, Pradeep. How are you?
Fine, fine, sir. How are you, sir?
இனிமேல் இப்படிதான் எல்லாம் ஜூம்ல தான் பார்க்க முடியும் போல இருக்கு. Very good. எல்லாம் நல்லா இருக்கீங்களா? வீட்ல நல்லா இருக்கீங்களா?
Yes, sir. Yes, sir. Good evening, madam. She's fine. She's fine, madam. She's fine.
Yeah, thank you.
Subha, Dr. C. N. Raja உள்ள வந்திருப்பார் பாருங்க.
Yes.
You should have come.
I have Dr. Augustin.
நான் வரையா? வர்த்தமான் கேள்வி கேட்ட மாதிரி அது. நமக்கு நீ சொல்லு. நான் கொண்டு வேலை.
No, ma'am. What name he will come in, ma'am? Will he come in any other name?
Raja.
கேக்குறியா? நீ இல்லையா காமியா? உள்ள எடுத்து போட்டுருக்கியா?
ரவிக்குமார் சார் அட்மிட் பண்ணிட்டு அப்புறமா.
மகன்.
Ravikumar
பார்சல்ல போதே
Unmute பண்ணாம பேசுறீங்க. பேசுறது கேட்பாங்க.
C. N. Raja sir வந்தாரா?
You have to call him, ma'am.
No, I called him. He said he will come in.
Okay then. Okay.
You should have come now.
Not yet. Yes, he's coming in.
Yes, come. Huh?
He's coming in. Okay. Are we okay to start?
Sir, vantaru.
Yes.
Yes, come pa. Yes, come. Doctor has come.
Yes, he's come.
We'll start. Good evening.
Welcome, sir. Good evening, sir.
Good evening, everyone. Good evening. Good evening.
Okay, we'll start.
Meenakshi, dear,
Yeah. Yeah.
are you there, ma?
Yes, I'm here.
Yes.
Yeah.
So you can start, dear.
Yeah. Thank you. Good evening, respected Chief Guest, Dr. Pradeep G. Nair, Dr. Priya Chockalingam, and our faculty advisor, Dr. Shruti ma'am, IMA officials, district officials, faculty and Rotractors of Stanley Medical College, members of Rotary Club of Chennai Bharati, Rotractors of Savita Medical College, and my dear friends. Put your heart, mind, and soul into your every smallest act. This is the secret of success. With the words of Swami Vivekananda, I would like to welcome one and all present here today to the Aspire Ryla series. At this junction, it is quite vivid as to what is next. But with the Ryla Aspire series, we would have a clearer picture of the future opportunities. I hand over the session to Honorary Secretary Dr. Jamina to start the meeting.
Thank you, Ma. Thank you. I welcome all our members of IMA Punnamalai High Road branch and members of Rotary Club of Chennai Bharati and medical students from Savita Medical College and Stanley Medical College for this CMA. Let us start this program with our IMA prayer in Tamil. இந்திய மருத்துவ சங்கம் வேண்டுதல். எல்லோரும் மகிழ்வுடன் வாழ, எல்லோரும் நலமுடன் வாழ, வலி என்னும் தொல்லை நீங்கி, அல்லல் செய்யும் இன்னல் நீங்க, பேராசை பிரதிபயன் அகற்றி, பிணி போக்கும் பெரும் பணி ஆற்றுவோம். Next, physician prayer by Dr. M. Premavati.
Good evening. மருத்துவரின் பிரார்த்தனை. எல்லாம் வல்ல இறைவா, உலகின் சிறந்த மருத்துவன் நீயே. உன்னை மண்டியிட்டு வணங்குகின்றேன். உன்னிடமிருந்து நல்லதும் சிறந்ததும் என்னை அடைய பிரார்த்திக்கின்றேன். எனது கரங்களுக்கு திறமையை தாரும். எனது மனத்திற்கு தெளிவான பார்வையை தாரும். இருதயத்துக்கு இரக்கத்தையும் துணிவையும் தாரும். எனக்கு அளிக்கப்பட்ட சிறப்பு தகுதியை தக்க வைக்கும் எண்ணம், வாடும் மக்கள் படும் பாட்டினை சிறிதளவாவது போக்கிட ஒன்றுபட்ட எண்ணத்தையும் வலிமையும் தாரும். என் மனத்திலிருந்து தகாத எண்ணங்களையும் உலகளவு ஆசையையும் அறவே ஒதுக்கி பணி செய்திட அருளுமாறு குழந்தை போன்று உன்னை சார்ந்து வேண்டுகின்றேன். தேங்க்யூ.
Thank you, Pramavati. Over to Suguna.
Yeah, thank you.
Over to Meenakshi.
Thank you. Your smile is your logo. Your personality is your business card. I request our ever-smiling President, Rotractor Binu Sherwin of Savita Medical College to deliver the welcome address and also share his experiences as a Rotractor.
Okay. Hi. Good evening to all IMA doctors, Rotractors, lecturers, Rotarians, and guests. Rotract is an organization of young adults of different professional and educational backgrounds that is defined neither by religious or nor political motives. Rotary Club offers great opportunities to the Rotractors to connect and other professionals who aren't afraid to lead and are dedicated to making a difference. We warmly welcome you to all series of sessions by Rotary Club of Chennai Bharati. Well, Rotractor Meenakshi, I was invited by my friend as I saw a lot of fun activities going on among the Rotractors. But after joining, I came to know that there were a lot of networking, knowledge sharing, and gaining. And the most important was a lot of giving back to the society. I was encouraged. I'm really happy to be a Rotractor. Thank you.
Thank you. Thank you. This beautiful event has been put together by the efforts of IMA and Rotary Club of Chennai Bharati. Request the President, Rotarian Swarnalata Mahesh, to welcome the gathering.
Is he there? Is she there? I think she's not there. You continue, ma. As soon as she comes, she will do that. Yeah.
Okay. The Indian Medical Association is a national voluntary organization of doctors of modern scientific system of medicine in India, which take care of the interest of doctors and the well-being of the community at large. The organization was established in 1928 with over 3 lakh doctors and its members throughout the country. It is a great pleasure and honor to take the IMA officials with us today. I request the IMA State President, Dr. C.N. Raja, Senior Consultant and ENT Surgeon, to address the gathering.
Thank you very much.
1 minute, sir.
Yes.
Sir, 1 minute. Let me welcome you, sir. This is the third CME program. Indian Medical Association Poonnamalai High Road branch is doing this program with Rotary Club Chennai Bharati. I thank Dr. Renuka Ramakrishnan, Director of Community Service Health, and Mrs. Suguna Devi Murugan, and Rotarian Swarnalata Mahesh, President of RCCB, for this great opportunity they have given. Now I invite our State President, Dr. C.N. Raja, for the presidential address.
Thank you, madam. Thank you for the nice words. Good evening to every one of you. The President and Secretary of IMA Poonnamalai High Road Branch, Dr. Jamuna, and other office bearers, Rotary Club of Bharati, Chennai, and Rotractors from Savita Medical College and Stanley Medical College, and the faculties, those who are going to address today's evening CME on the cholesterol and other cardiac issues. I think every one of us, we got used to how to handle and use the webinars in a productive way. Likewise, the Poonnamalai High Road branch is one of the very, very active branches in IMA Tamil Nadu, especially in Chennai. There are many branches in Chennai, but some of them are very active. And I really appreciate the President Secretary for regularly conducting the CMEs for the benefit of our members. And you have actually invited the Rotary Club to be with you. I think that is a good gesture to involving the other NGOs and getting their help and support. Also, at the same time, they will be able to understand what Indian Medical Association is doing. As rightly pointed out, it is one of the very oldest organizations, started 1928 with more than 3.5 lakh members, one of the biggest NGOs, I would say, in the world. We have a lot of issues, a lot of problems, and the IMA is been started to propagate the knowledge and updating the medical field, what is happening in various aspects. That was the main idea, but slowly it has changed itself into, it spread out its arms and wings, and now it has become one of the custodian and also a complete protector of the modern medicine practitioner. Since we have the young students today from Stanley Medical College, one of the very oldest medical colleges and reputed medical colleges in the world, which has produced lots and lots of talented doctors, and also all the time the Stanleyan spirit among the Stanley students, all very well known wherever they go, irrespective of their age and position. If they are a Stanleyan, they say, I am a Stanleyan, I am from the Stanley. So that spirit they always have, and to be appreciated. Likewise, we have the students from Savita Medical College. As a medical students, we study the medicine as a science, but many of the practical issues, problems, we are not aware when we are students as an undergraduate level, even at the postgraduate level. But once you come out of, am I audible now?
Yes, sir.
Yes, sir. Yes, sir.
Okay, okay. Once you come out and start practicing, there are challenges, problems, and you need to face it that every day. So in this aspect, the Indian Medical Association trying to help our members I think most of the seniors will agree. I request the young medicos, once you come out, you become a member in the Indian Medical Association. As you when register yourself as a medical practitioner, you are entitled to practice once you register the medical council. And similarly, it is your duty to become a member in Indian Medical Association, which is there in the bylaws of the Medical Council of India. Even at the student level, now the IMA has started the Medical Students Network, MSN. For your information, you please visit the website of the National IMA and you can be an associate member and get the benefits. And we have a lot of programs for the young medicos, career guidance and other material and moral support. And whatever problems you have, you can come to us, and we have a separate session in all the national and state level. We encourage medical students come and address their own problems. And we, the seniors,
What happened, Suguna?
I think his network is problem, ma'am. So,
most of our professional life, we have achieved our graduation, post-graduation, position in the private life, in the family life and everything. But we are for the next generation of doctors, especially if you see the new educational policy.
I think his link had an issue. Yeah. I think he's gone. He has to come back in. Okay.
Hey, unmute him.
He's not there.
Okay.
Yeah. Yes, now you are correct.
Madam, am I audible and clear now?
Just now you are audible, sir.
All right, then probably for quite a while I'm not audible and not seen.
Oh, yes, not
just
audible.
1 minute, sir. Just 1 minute. Just now you just left and you're coming back in, sir.
Right. There is some network problem here. Now it is all right now. So that's what I'm trying to say. The students should join the medical students network and get the guidance from the IMA. You don't think that the IMA is only for the seniors. After 40 years, we can join in IMA. It is not so. We encourage even the students to be the associate members and actively participate in all the IMA activities as you are participating, taking interest in the road track. I was a road track member when I was a medical student. I remember that very clearly. So what I appeal to the young doctors, I mean young medicos, please keep updated or keep always get yourself know what IMA is doing. IMA is mainly doing for the interest of the young medicos. And I was mentioning about the new educational policy. The new educational policy is trying to undermine the importance of the modern medicine. And if you see that it is totally trying to destroy the future doctor, and it is going to be a pluralistic doctor where a doctor should practice modern medicine and also other Ayush like homeopathy and yoga and Unani and all those things, and which is not desirable and which is not wanted, and it will be vice versa. Those Ayush doctors should also can practice modern medicine. So all these things are going to jeopardize the interest of the future doctors and their interest in this great country. So you have to be aware of all these challenges and try to address along with the mother body IMA. So we need youngsters, young blood and young mind to have this, oppose this, and so that the interest and the uniqueness of the modern medical doctor is kept alive. And the Indian doctors are very much respected all over the world. Even the UK and USA, without the Indian doctors, they cannot run their healthcare system. The same thing, we've been working very hard, even this COVID era, the modern medical doctor only doing all the services and all the sacrifices. So I really appreciate Pundamalai High Road branch for having invited the medical students, and this should be a regular affair. Every now and then, please bring them, encourage them to join the IMA. Then only they will be able to know what is IMA is doing. I hope this evening's deliberations will be very useful to all members. I'm very extremely happy that you have invited me to be here this evening. Thank you very much, and blessings and greetings to you all. Thank you.
Thank you. Thank you, sir.
Good evening to all, ma'am. Good evening, Dr. Jamuna, ma'am, and everyone.
Good evening. Good evening, Renaka Ramakrishna.
Punamali branch. I'm extremely sorry. I've been some issues at home, so I've been very busy. I'm very happy to join at least now on an audio call.
Thank you. Thank you, ma'am.
Yeah, Meenu.
Yeah, thank you. I request Dr. A.K. Ravikumar, General and Laparoscopic Surgeon, the Honorary Secretary of IMA, to address the gathering.
Very good afternoon to, yes, madam.
Yes, sir. I wanted to invite you. That's it, sir.
Okay.
Welcome, Ravi. Welcome, Ravi.
Good afternoon, sir. Good evening, sir. So very good afternoon to one and all. And it's a very great pleasure to be with the group of Rotarians, Rotaracts, IMA members. It's very nice that the IMA Pundamalai High Road has formed such a group of people gathered together and conducting programs. It's really wonderful. It's very rare to see the branches doing like this. So out of 166 branches, I would say that hardly about 20 to 25 branches are only doing such very good activities. I think President will agree with me. All other branches, of course, they are all doing the activities, but not like your branch. So first of all, I just want to congratulate you, the team, with Dr. Jamuna ma'am and her team for doing wonderful activities during this COVID era. As you all know, the COVID, we have now, initially we all were worried about the COVID and we were hesitating to come out of our house. We were hesitating to do the practice and so many things. But now we have learned to live with Corona. That's it. So we have to live with Corona for another 1.5 to 2 years. That is for sure. And as our president said, joining IMA, the youngsters, the Rotaracts and the Rotarians who are here from the medical colleges, you have come over here. Joining IMA is very, very important because for any profession, an association's backup is very, very important. You have to join in whatever profession you are. You need to join an association which will back you up. The Indian Medical Association, one of the largest NGO and branch for the welfare of the doctors. If you join, it is the greatest protection which you get. So the youngsters, you should feel that once you are an IMA member, you can feel that you are totally protected. not only yourself, your family is protected. You know, we have various other schemes, the schemes which will, we have FSS scheme, we have PPLSS scheme, we have various wings like allied medical specialties, we have CGP, where we have the College of General Practitioners giving awareness programs and teaching programs for the general practitioners. We have a separate wing called the nursing home board wing. If you are willing to join, start a nursing home, we give all guidance for you to start a nursing home and how to run a nursing home. And if you have any problems, we are here to safeguard you from various problems. And also we are here to give you various guidance and knowledge sharing. So really it is very, very important that the youngsters should join Indian Medical Association. Whatever specialty you take, IMA is the mother body, and with this mother body you have various other specialty associations that you should keep in mind, and basically you should become an Indian Medical Association member. And I congratulate Madam for inviting all the Rotaracts and the Rotarians into this forum. And I am proud to say that I am a Rotarian Dr. Ravi Kumar. Really, of course. It gives great pleasure and privilege to say that Rotarian, say as a Rotarian. And today being a very important day, you know, it is the World First Aid Day, you all may be knowing. It is being celebrated across the world in every second Saturdays of September. And today being the World First Aid Day, the topics the madam has selected also is correlating with the first aid. The cholesterol, though it may look like a cholesterol, the cholesterol is the main culprit for so many things for us. And of course, the symptoms which we get due to the complications of the cholesterol needs first aid treatment. And I think the faculties who address the cholesterol topic will include tips of first aid to be given in case of any complications related to the cholesterol. And you have cardiopulmonary rehabilitation, resuscitation program also. That is one of the most important one, which is not only for the medical professionals, it is also for the each and every citizen of the country should know how to resuscitate a patient. Because in Indian Medical Association, we had a G1 program in nursing home board, which we used to conduct for all the people, public, colleges, schools, and the police people and all. So this First Aid Day, how it started was in 1863, the Indian Red Cross Society was formed following seeing a very big calamity following war. And the many people were suffering from due to the war, and the first aid need of the first aid was very, very important at that time, and it was understood, and the Indian Red Cross Society was formed in 1863. And subsequently from 2000 September, from the Indian Red Cross Society, they wanted to promote and encourage and create awareness to the public on first aid activities. And it is nice that today you have a program with the youngsters, involve the youngsters. And my humble request to all the youngsters is, practicing is different. You can study, you can become a very knowledgeable person, you can practice for your earnings, and you will be practicing. But my humble request is, you join like Rotary, Rotaract, or any other associations, and do some service to the public. And as medical professionals, what best service we can do is, the first aid program is one of the best program which we can do it. I am proud to say that I used to conduct first aid programs for the school children and the neighboring residential locations along with the Rotary Club regularly. So I have a set of slides, nearly about 100 slides, basic first aid measures we used to teach them, because a patient can swoon in the house, they may not know what to do. A patient can throw fits, they will immediately give some rod in their hand and they will try to feed the patient with water and other things. So many things are there which can be taught to the public. So I request all the youngsters, first to join Indian Medical Association. Next, you join some associations like Rotary, Lions, or whatever you would like to join, and do service to the public. The service will stand. Service to community is service to God. So thank you for giving me an opportunity to be part of your program. Thank you very much, madam, and thank you all members. Thank you very much.
Thank you, doctor.
Yeah, Meenakshi.
Yeah. Our Rotary Club of Chennai Bharati's president, Rotarian Swarnalata Mahesh, has joined us now. Request you to address the gathering, ma'am.
Unmute yourself, President.
Good evening, all. I take it a pleasure to be before you all at this forum. This is a Ryla series organized by the Chennai Bharati Club. The Rotary Club of Chennai Bharati was involving itself in many of these youth activities. Now today, with the help of other clubs, I've got this opportunity to bring about with IMA this session for the Rotary College of Savita Medical College and Stanley Medical College. So I take it a great privilege that these students are going to be highly benefited from these two, from speaking of these two doctors. And the topic also seems to be very different. And of course, as a layperson, I do not know much about this, but when I read the topic itself, it was different. So the curiosity in me is just killing me to know what more about this cardiology. And dear students, please make note and take notes from this so that you will know what next after you do your basic MBBS degree, your graduation, how you have to pursue your higher education, what forum you need to look into. And as advised and spoken about by the state president and the state secretary of IMA, I request you all to do the needful. Get yourself enrolled in the associations and in the medical forums as and when available to you. It would be a great platform to you. I thank the Ryla series, the youth chair of my Rotary Club of Chennai Bharati, who is also past president, for having initiated this. It is her, idea of this knowledge series, and I hope that all of you will benefit from this knowledge series. Thank you.
Thank you.
Thank you.
In the middle of difficulty.
Yeah, Meenu, continue.
In the middle of difficulties lies opportunities, are the words of Albert Einstein. In these stress situations, it is a blessing to have people with great knowledge and experience to throw light on what the future looks like. I request Rotractor Kavya to introduce our speaker, come chief guest, Dr. Pradeep G. Nair.
Good evening. This is Kavya K. I'm a pre-final student from Savita Medical College. I'm the Vice President of RCSMC. So let me introduce Dr. Pradeep G. Nair. He's a senior consultant, interventional cardiology. Dr. Pradeep completed his super specialty training in cardiology at the reputed Southern Railway Headquarters Hospital, Chennai in 1998. He has vast experience in interventional cardiology, having worked at Railway Hospital, Perambur, Madras Medical Mission, Frontier Lifeline Hospital, and Chettinad Medical College, where he was a professor and head of cardiology, and in MIOT Hospital, Chennai as Director of Academics and Senior Consultant. He is presently Senior Consultant Cardiologist at Fortis Muller Hospital. He is a dedicated teacher and has trained more than 30 students in cardiology. He is a Fellow of the Royal College of Physicians, Edinburgh and Glasgow, Fellow of American Heart Association, American College of Cardiology, and International Society of Cardiac Interventions. His main area of interest are interventional cardiology and cardiac failure management, and he has over 40 publications in national and international index journals. He was awarded Best Doctor Award for outstanding contribution in the field of medical education and health services by the Tamil Nadu Dr. MGR Medical College University in February 2012. We welcome you, sir, and over to you, sir.
Thank you. Thank you. I'll just, at the outset, I'd like to thank IMA Punamali, Dr. Jamuna, and the Rotary Club of Chennai Bharati, and the Rotractors of Stanley and Savita Medical College. Now, how do I get onto this? Yeah, can you see the screen?
Yes, sir.
Yeah, so this topic basically we chose because there is a lot of controversy in what cholesterol is. Whether cholesterol is useful for us, whether cholesterol is dangerous for us. All the time we know that there is a danger in having a high cholesterol. But what happened was in the recent past, there's been a lot of, social media campaigns saying that cholesterol is actually good, and it's the doctors and the medical fraternity who are making it, are criminalizing it and making it villains. It's actually good. We can have cholesterol, high cholesterol. There's nothing wrong with it, and so this type of a controversy by the various social media setups have, created a lot of questions in all our minds, including me. What are we actually doing? In fact, there was a post in Washington, there was a thing in Washington Post which said that cholesterol is finally officially removed from the naughty list. The US government has finally accepted that cholesterol is not a nutrient of concern, doing a U-turn on their warning. So this type of social media posts confused all of us. Now, so I will just give you a brief on exactly what cholesterol. Cholesterol, definitely, we do need cholesterol in our body. Why we need it, I'll go through it. And when it can do harm, then also I'll go through. Now, most cholesterol, where does cholesterol come from? Most cholesterol, about 80%, is made within the body. The liver synthesizes cholesterol needed by the body, which is approximately 900 milligram per day. And synthesis within the body starts with the mevalonate pathway, where two molecules of acetyl coenzyme A condense to form acetyl coenzyme A. Now, I put acetyl coenzyme A in red because this is a crucial molecule that plays in this game. Now, only a small amount of dietary cholesterol is absorbed in the diet, 15 to 20%. That is why there is some truth that if you have a little extra cholesterol, it's not really harmful. But what happens is, if there's extra calories, if it's consumed, it's converted into cholesterol by liver. So long, we were paying attention, cholesterol is bad, cholesterol is bad, cholesterol is bad. Of course, cholesterol is bad, but it is not as bad as the calories, the carbohydrates that we consume, especially in the Indian diet, where we eat a lot of rice, a lot of fried items. These are converted to cholesterol by the liver. Therefore, whatever attention we were giving to cholesterol per se must also be given to the amount of carbohydrates that we consume. That is what we need to do. Now, why do we need cholesterol? Cholesterol is needed to build and maintain cell membranes. So it's a basic molecule that the body needs. It modulates membrane fluidity over a range of physiological temperatures. So if you don't have cholesterol in your blood, your skin won't be elastic. All your cells will not be elastic. They will be, non-elastic and very difficult to move. Cholesterol serves as a precursor for biosynthesis of steroid hormones, bile acids, and vitamin D. So cholesterol is needed for the synthesis of these chemicals. And it's also important for nerve transmission and is particularly abundant in nerve tissues. So cholesterol definitely is needed. Now, but what level of cholesterol is needed is where the controversy starts. Now, if you see here, cholesterol, you can see, like springs in the plasma membrane. They're like springs. They help the plasma membrane be elastic. So it is very necessary for cholesterol to be there in all the plasma membranes. Now, how is cholesterol produced? Whether we have carbohydrates, whether we have fats, whether we have proteins, they all have to go through the citric acid cycle, and the final product is an acetyl coenzyme A molecule, which can be converted to energy plus carbon dioxide, or if there's an excess, say, of amino acids, if there's an excess of glucose, they all get through the acetyl coenzyme A, it can be converted to fats and stored in the body, which can later be converted to cholesterol. And that is where the danger arises. So whether you have excess cholesterol, carbohydrates, or whether you have excess proteins, or you take fats, all of them are converted through acetyl coenzyme A to body fat. And this is what is bad. So excess of anything, excuse me, it's not just the excess of fats and cholesterol that you eat, it's the excess of anything, whether you have glucose, whether you have carbohydrates in excess, whether you have proteins in excess, all of them will be converted to body fat. And that's where the problem is. Now, what happens to excess carbohydrates that we consume, which is very common in our Indian diet? You don't have enough insulin to move all that glucose into your cells. Your pancreas starts making more insulin. Your body experiences the high insulin levels as a stress messenger. You know that insulin is a stress hormone. It definitely helps metabolism of glucose, but it's also a stress hormone, and anything insulin in excess can lead to a lot of problems. One is inflammation. Insulin in excess causes inflammation. Now, this inflammation word will come quite often in my talk, and this is the key word actually, where coronary artery disease and atherosclerotic damage is concerned. Inflammation contributes to cardiovascular disease, autoimmune disease, and cancer. So, excess of carbohydrates, insulin is secretion is increased, and this causes inflammation, which can lead to many of the medical problems that we face today. The other thing is adrenal stress. Because insulin is hyperinsulinemia is there, it contributes to weight gain, diabetes, and high blood pressure. So insulin, like cholesterol, insulin is a good thing, but too much of insulin is bad. Similarly, carbohydrates is good to a limit, but beyond that, it is bad. And that is what is wrong with our diet, especially processed carbohydrates like sugar. What we have, sugar, we sweeten all our food and all with sugar. All these are very dangerous as far as your heart is concerned, because they cause inflammation. Now, what does the high protein diet do? A lot of bodybuilders and a lot of young people these days, they all go to gym, they take a lot of excess proteins to build up their body. But what happens is, if your caloric intake is low that day, your cells can convert excess amino acids to molecules that can burn as fuel. But if along with that high protein, if you consume plenty of calories, then your body has no choice but to convert the extra protein to fatty acids and store them in your adipose tissue. So that's why the Atkins diet and this high protein diets, they are good, provided you do not take too much carbohydrates. If you take too much carbohydrates, what happens is the carbohydrates are used as substrate for energy, and the proteins, excess proteins, are converted through the acetyl coenzyme pathway to fatty acids. So protein, here again, protein is a good thing, but too much protein alone with calories is bad. Along with calories, this thing is bad. So too much of anything, basically this moral of the thing is, too much of anything is bad. There is too much of cholesterol, too much of sugar, too much of fat, too much of proteins is not good for your health. All this can, especially carbohydrates, can cause hyperinsulinemia, which is an inflammatory, mediator. Now, as far I'm a cardiologist, so I am worried about the coronary arteries, and coronary artery disease is the biggest bulk of pathology that we see. And what causes it? Now, all of us think it's just the cholesterol causes it. Cholesterol does cause it, but how does it cause it? And is it only cholesterol that causes it? That is what I'd like to discuss. Now, it's basically caused by coronary artery disease, basically caused by inflammation. Anything that can cause inflammatory damage to the endothelium or the inner lining of your blood vessels, they can cause coronary artery disease. So it may be cholesterol, but there's a big list of things that can cause inflammation. So cholesterol is just one of the molecules that can cause inflammation. It's probably the most important, but there are many. We all seen inflammation. This is how inflammation of the eyes look. You know that conjunctivitis, how it looks. You can see inflammation of the joints. We all know about this, very familiar with this. We are familiar, all of us at some point of time have fallen on the ground, scraped our skin, and this is what it looks. We're all familiar with this. But what we are not familiar is what this similar inflammation takes place within the endothelium, within our blood vessels. Now, when you have diabetes, high cholesterol, high blood pressure, stress, all these cause inflammation of the endothelium. And this is a scanning electron microscope picture of the endothelium. This is a real life of a patient who died of a heart attack, patient who was diabetic and hypertensive, and you can see how the skin is, how the endothelium is. If I see this area, I don't know if the arrow is visible on your screens, but this area is a normal endothelium. And this area is where the endothelium has been damaged. You can see how similar to how, you scrape your skin and some abrasion is there, similar to that. So all patients with diabetes, with hypertension, with high cholesterol, with high stress levels, and smoking, all these issues can lead to this type of situation within your blood vessels, whether it's the coronary blood vessels, whether it's the cerebrovascular blood vessels, whether renal blood vessels. This is how it looks when you have these risk factors that cause inflammation of your endothelium. Now, once this happens, then we all know the coagulation cascade comes into play. You have a clot forming there, and you have MI, because it blocks the blood vessels supply to the heart, or you have a stroke if it blocks the blood supply to the brain. Now, when did we really start appreciating that it's not only cholesterol, but something else that leads to these type of coronary events? It was the Jupiter trial and some other trials also, but this is the landmark trial where they found that despite reducing LDL to less than 70, which is the target, patients, if the CRP, which is an indication of the inflammatory level in their body, if the CRP is high, then the patients still continue to have cardiac events. So you not only have to bring down the cholesterol levels, you have to bring down the inflammation in the body. So now if you have a normal cholesterol, but you're highly stressed, or your blood sugar is very high, or your blood pressure is very high, you can still, or you're smoking very much, you can still have a heart attack if your CRP levels are not in control, because CRP is a reflection of the inflammation within your body. Now, does cholesterol actually cause inflammation in coronary arteries? The proof of the pudding is in the eating. Now, this is circumstantial evidence. We have seen so many studies. I don't know, students will not have gone through the studies, but the most of us in the IMA, doctors and all, we know that as you reduce the total cholesterol, the level of total cholesterol as you reduce, you find that the events, the cardiac events reduce. So, by inference, if cholesterol causes inflammation, cholesterol causes cardiac disease, and if therefore you control cholesterol, you will not get, at least you will prevent to some extent heart attacks. Now, LDL-C is a type of cholesterol, and that the lesser, studies have shown that the lesser LDL among the cholesterol, different various types of cholesterol, lesser LDL that we have, the lesser chance of getting heart disease. So among the cholesterol, LDL-C is the most dangerous. High LDL-C is highly inflammatory for the endothelium. Now, how does cholesterol cause coronary artery disease? High plasma LDL causes LDL infiltration into the intima. It causes oxidative modification of LDL. There's macrophages, foam cells, fatty streaks, endothelial inflammation. Again, here, injury and inflammation, there is adherence of platelets, release of various cytokines, and a fibrocalcific lesion. I hope I'm audible. There's some disturbance. Now, Now, there is a clustering effect. Tonight, as I told you, whether it's cholesterol, whether it's high sugar, whether it's high pressure, whether it's smoking, all of these are cause inflammation. And if you have multiple, most people will have multiple, this is what we call clustering. So they may have high cholesterol, but along with it, usually they will have hypertension or blood sugar, diabetes, or they smoke, or they have high stress. Then the effect, the inflammatory effect of all this is multiplied, and the chance of getting a cardiac issue is very high. Now, this is one of the landmark trials, the INTERHEART study. And here again, you see there's so many, whether it's smoking, less fruits and vegetables, less exercise, excess alcohol, hypertension, diabetes, abdominal obesity, psychosocial, now stress. Now, psychosocial, if you see, is 33 here. After lipids and smoking, psychosocial stress is an important cause for inflammation. So all these can lead to a heart attack. Therefore, it is not only cholesterol, it's the inflammation that cholesterol and various other modulators, various other risk factors cause to the endothelium that causes a heart attack. Now, what are the causes of endothelium? There's a big list. We know the major risk factors: LDLC, non-HDLC, diabetes, hypertension, chronic kidney disease, family history, genetic background is very important. And we know advancing age itself is a risk factor because you cannot escape inflammation. As you grow older, there are more stress on your body and there is inflammation. Now, other additional risk factors which we are only appreciating in the recent times: lipoprotein A, clotting factors, ApoB, small dense LDLC, triglyceride remnants, homocysteine. All these are all additional and risk factors that we have only learned to appreciate in the recent past, and may cause, despite your cholesterol being normal, any of these other factors, if they are high, they can cause inflammation, and that can result in coronary artery disease and heart attack or stroke. Now, LDL cholesterol, I'll just take one type of cholesterol after and let you know how it affects the heart. Now, LDL cholesterol, see, what we normally see is a total level of LDL cholesterol, but we do not, in the normal lipid profiles, we do not differentiate between large LDL and smaller LDL. Now, there are two types of LDL. There's a larger phenotype A, large LDL, and a smaller phenotype, this phenotype B. Now, what is more dangerous is phenotype B, because these are smaller particles. They can enter through the endothelium faster, better, and they're slowly cleared from the cells. Therefore, they are more dangerous. So if a patient, say, has LDL level of 100 mg/% or even say 70 mg/%, we are very happy. Okay, patient's LDL is reasonably under control. But if it's mostly small LDL, then it is not good for the patient. But if it's mostly large LDL, then patient is protected as we expected him to be protected. But if it's small LDL, now unfortunately this differentiation between small and large LDL particles is not done in our normal lipid profile, and these need higher level of tests to be done, and that is where we lack in this. Now, the larger LDL particles, LDL-A is good. It's not bad. I won't say it's good. It's not bad, but the smaller ones are dangerous. So even when we do, so there are a lot of patients when they come with a heart attack, the LDL may be normal, but they may have and they still have a heart attack. Two things. One, the LDL are small particles, and therefore they were the dangerous type of LDL, even though 70 mg/%, or they have other inflammatory mediators like high cholesterol, high sugar, or high blood pressure, or stress, or smoking that has caused the heart attack. Now, coming to triglycerides, diabetes, obesity, insulin resistance, and metabolic syndrome. Their high triglyceride levels are seen in all these clinical situations. Absolute levels of LDL cholesterol not significantly increased, but there's an increased number of small dense LDL particles. The importance of seeing a high triglyceride level. The triglycerides per se are not dangerous to the blood vessels, but when there is a high level of triglycerides, the amount of small, like I told you earlier, the small LDL particles are very high. So even if you have LDL levels normal, but you have a triglyceride level that is high, then you are still in danger, because those LDL particles are small, dense LDL particles, which are very dangerous. Now, these patients usually have low levels of HDL cholesterol, which is protective. So when there's no protection, the more chances of heart attacks. Now, if you see here, HDL, the higher the HDL, triglyceride levels, meta-analysis of 17 studies, I won't go through too much in detail, but the more high the triglyceride levels are, the less the HDL levels are, and therefore the risks are higher. Again here, metabolic syndrome, reduction in metabolic syndrome, once you treat the triglycerides, automatically the level of risk for getting a cardiac event comes down. Now, as of now, however, none of the associations, whether the American Diabetic Association or various other standard associations that we follow, they have not yet recommended treating hypertriglyceridemia for CVD risk, but some studies are on, like the field study, where fenofibrates and niacin and all been tried. Some of the studies have failed to show any reduction in CVD outcomes, but this we had to wait and see whether it is actually useful if you reduce triglycerides. So there are some studies like the strength and prominent, which are all ongoing. Once the results come out, we all know that LDL has to be reduced. Whether triglycerides also has to be reduced, we'll come to find out. Now, the reduce it trial, I don't think I'll go too much detail into that. Now, HDL, this is the third major type of cholesterol, and this is supposed to be protective. Now, if you see, if the HDL is low and the LDL, if you see this, if you see the LDL is low, but the HDL is also low, then the chances of MI are high. So you not only have to have a low HDL, you have to have a low LDL, and you have to have a high HDL. Then only your protection is good. Plus, this LDL that you have, that should be the large particles. It should not be the small particles, because if this LDL is small particle, despite it being low, you can get a cardiac event. Now, statin therapy, of course, now statins, I know as students, you wouldn't have come, reach the level where you start statins and all that. But statin therapy also, it does not help if the HDL level is low. So the protection that statins give is lost if HDL levels are low. So now the current concept on managing cardiac events is you not only have to reduce cholesterol, you also have to reduce the inflammation in the body. And the inflammation is measured by the hsCRP level in your body. So the current concept is you not only measure the lipid profile, you measure the hsCRP. hsCRP reflects the total level of inflammation, the level of inflammation your blood vessels are going through, and that inflammation can be contributed to by a high blood sugar. It can be contributed to by smoking, high blood pressure, stress, environmental, pollution. All these can cause inflammation, and just reducing cholesterol is not enough to reduce heart attack or cardiac events or cerebrovascular events. So the take-home message is cholesterol is needed by your body, but the level, what is the level? Now, the current levels for patients with other risk factors is 70, but slowly studies are showing that we should bring it down further to around 40 or so, but that till now recommendations still stay at 70 mg% for patients with risk factors. Liver is the major source of production. So the amount of cholesterol that we ingest orally is not as important as the amount of cholesterol that is produced in the liver. However, if we consume excess of cholesterol or excess of anything, whether it's carbohydrates, proteins, these are all converted by the liver to fatty acids and cholesterol. Dietary cholesterol comes only from animal source. Now, this is very important. There is no vegetable source for cholesterol orally. Most cholesterol, all cholesterol comes from animal source. So if you are a vegetarian, actually you are not supposed to get, hyperlipidemia. But the problem is, as I told you, it is just not the oral food that you're taking. It's also the liver production. So you may be a vegetarian, and you, of course, milk, of course, is not this thing. Milk has cholesterol, but other vegetarian foods do not have cholesterol. But you should not be, complacent saying that I won't get cholesterol, because it depends on your genetic makeup and how you may have excess carbohydrates, which may be converted to cholesterol in the liver. So it is just not the cholesterol that you take orally that is important. It's everything. Anything in excess can be converted to fatty acids and cholesterol. Like I said, now your genetics is a major determinant of lipid profile. So all of us should, look at our family tree regarding the risk factors, regarding diseases that are there, and accordingly, adjust our lifestyle. If your parents are diabetic, parents have history of heart attacks, then you also must be careful, because you are highly prone for these diseases. Now, high cholesterol is a major cause of CAD, but there is only a major cause. There are other causes of coronary artery disease. Statins, of course, reasonably safe and remain the mainstay of treatment. And definitely do not use WhatsApp and YouTube as your reference textbook. Please do consult your regular textbooks rather than WhatsApp and YouTube messages, because there's so much controversy that are, just for sensationalism, it's passed on in the thing. Now, I don't know, but I've taken quite a bit of your time. Dr. Ravi Kumar wanted me to show some of the emergencies and how to treat it, but the time factor is there, and maybe in another talk, we will definitely deal with those, how to manage emergencies. And of course, I'm open to questions after Dr. Priya's talk. Then we can, if suppose orally, I can definitely tell you some idea on how to manage emergencies. Thank you.
Sure, sir. That was really wonderful.
Thank you, doctor. We gained a lot of information in a short while, I guess. Thank you. We, the Rotractors of Savita Medical College, take great pleasure and pride in projecting before this august gathering our two signature projects, Shema and Tulir. I request Rotractor Kavya to take over from Savita Medical College.
Thank you, Meenakshi. First, we'll talk about one of our important signature projects, Shema. Cancer isn't all rainbows and butterflies, and once a patient enters a dark mindset, it can be hard to get out of it. Most of us have that one message of hope and inspiration that somehow manages to help bring some perspective and optimism to a situation. We, the budding doctors of Savita Medical College, representing RCSMC on 10th of March 2021 from 9 a.m., will conduct a medical camp to create awareness and also of cancer screening to diagnose early stages of cervical and breast cancer so that it can be treated, thereby preventing the patient from suffering further. And we'll have an expected number of beneficiaries of 150. Next, we have one more event called Tulir. Not all smiles are created equal. India is known as a land of contrasts. 1 in every 600 children in the world suffer from cleft lip and cleft palate. But it takes around 1 hour to correct the defect, with an aim to restore the beautiful smiles, the minimum Kurunagai. The SIPRACS Cleft Care Center at RCSNC have collaborated with the German Cleft Lip Center, Deutsche Cleft Kinderhealth, ABMSS Smiles, Bangalore, and Transforming Faces. This project will begin on 16th October 2020. The surgery will be fully sponsored for the little ones, and we have about 1,000 expected beneficiaries in a year.
Thank you, Rotractor Kavya. I request Rotractor Muthu Robin from Stanley Medical College to introduce our next speaker cum chief guest, Dr. Priya Chockalingam.
I take immense pleasure in introducing our next speaker of the event, Dr. Priya Chockalingam, a well-established and a renowned cardiologist. Ma'am did her MBBS in Madras Medical College her MRCPCH in Royal College of Pediatrics and Child Health, United Kingdom. Her PhD in University of Amsterdam, Netherlands. She is the founder and clinical director of Cardiac Wellness Institute, Chennai. She was also a research fellow in cardiology in University of Amsterdam, Netherlands. A researcher in fetal cardiology in Switzerland. She also worked as a medical officer in Chennai, Mumbai, and Kuala Lumpur. Ma'am authored several chapters in textbooks of cardiology by JP Publishers. Ma'am has published more than 25 scientific papers in internationally renowned peer-reviewed journals and has presented in more than 15 international and national conferences. Ma'am has authored books in the name of Journey to Healthy Heart, Mind Your Heart in English, and Idayam Kaka in Tamil. We are happy to have you here, ma'am. Over to you, ma'am. Thank you so much.
Yeah, good evening, everybody. Anevarukkum vanakkam. At the outset, I would really like to thank Dr. Jamuna of IMA Punnamalli and the Rotary Club of Chennai Bharati for having me over and organizing this wonderful event. It gives me great pleasure and pride and honor. It gives me great pleasure and honor to be addressing I think somebody has to mute their mics.
Yeah, I'm doing it, ma'am.
Okay, great. It's an immense pleasure and honor to be able to address my, friends, colleagues, even my professors are here today, and such lovely, wonderful students. Thank you for that lovely introduction, Dr. Muthu. Yes, I completed my MBBS from Madras Medical College in the year 2000 and left Chennai. So I was, traveling, had about the opportunity to live and work and even raise a family in 5 countries across 3 different continents. And after a decade, so in the year 2012, I relocated back to Chennai. And I would say I was extremely shocked by the rapid rise in the incidence of cardiovascular diseases, particularly myocardial infarction, and to the level that almost every household had somebody with heart ailments and cardiac procedures. In fact, the quality of life of most of our kith and kin also seemed to have drastically dropped, due to the rampant diseases. Just now, Dr. Pradeep has thrown wonderful light on cholesterol itself, but dyslipidemias, diabetes, and hypertension was just so rampant, and people did not have much awareness about how healthy lifestyle could help in reversing and curing these diseases. So I think that was the fundamental reason for the birth of Cardiac Wellness Institute. We founded it in 2014. And the main aim or the mission of our institute is to provide scientific, evidence-based and world-class prevention and rehabilitation programs for our own population on par with what is available in the West. And I think this has been a wonderful, incredible and challenging journey. And I think I would like to use the next few minutes to share our own experience and use this knowledge sharing opportunity with all of you today. Let me share my screen. I hope my slide is visible.
Yes, ma'am.
All right. So yes, so recent advances in cardiopulmonary rehabilitation. And it's a great coincidence that today is World First Aid Day. Also, September is celebrated as World Heart Month. 29th of September is World Heart Day. So this year, the theme is use your heart to beat heart attack. So in the sense, be more aware and, use your heart, use your, your love and care for others to prevent this growing epidemic. So I will be touching upon the disease burden of cardiovascular and chronic lung diseases, talk about some risk factors, what is the role of rehabilitation in the reversal and cure of these diseases, and of course share some lovely tips for all of you to incorporate a heart-healthy lifestyle, and probably we'll have some time for questions. So the 2 main groups of health issues that the world is facing are infectious diseases and lifestyle diseases, or in other words, communicable diseases and non-communicable diseases. So we are right in the middle of the COVID-19 pandemic. Unfortunately, it's taken a big toll all over the globe. We have almost 3 crores people affected with the disease so far, and just over 9 lakhs have succumbed to the disease in the last 6 to 8 months. And in comparison, cardiovascular disease, which is the most, the most threatening lifestyle disease, around 50 crores, 500 million people are affected worldwide. And every year, we have about 2 crore people dying of cardiovascular diseases. So we have both these definitely are killer diseases. One is a lifestyle disease or a non-communicable disease, and we're going to be talking more about it in the next few minutes. So the leading cause of death in men and women throughout the world is heart disease. So if you see this graph here, so heart disease is the #1 cause of death in men and women. So many women are not aware of this. They are aware of diseases like cancer, particularly breast cancer and other diseases. But yes, heart disease has overtaken all the rest to become the leading cause of death. And if you look at this chart here, this is to show what is the global heart disease burden in terms of DALYs. DALYs is the disability adjusted life years, that is the morbidity cost and mortality cost due to ischemic heart disease or coronary artery disease. Everything in dark maroon is very highly burdened. So we have India right here, both in upper panel in men, lower panel in women. So most of the low and middle income countries, that is India, China, and other countries, are facing a heavy burden of ischemic heart disease. And again, this is more specific national data. So again, the dark red is not a good sign. So in Tamil Nadu and our neighboring state of Kerala, we have more than 5,000 people per 1 lakh population affected with cardiovascular diseases. So I think it is something which is very important to us, very close to our hearts, and we as the medical professionals need to take this as a responsibility. And as I said, in the last couple of decades, what has become very disturbing is that the age of the first heart attack has fallen dramatically in Indians. So that means that we are almost 20 years younger than the Western population when we have our first heart attack. And if 100 people present to an emergency department with a first heart attack, almost a quarter of them, 25% of them are below 40 years. So gone are the days when we were taught that this is, heart diseases, heart attack is a disease of older people and men in their middle age and above. No, it is affecting all age groups and all genders. So I think all of us have to take note of this. Dr. Pradeep has very nicely touched upon the mechanism of the coronary artery disease. Atherosclerosis is one of the main contributing mechanisms. And of course, the blood clot which forms on that. So the inflammation in the epithelium of the coronaries is one of the main causes for that. The other, let me go back. Yeah, so the other mechanism is the spasm of the coronary artery. So that's called the coronary artery spasm that can cause a severe constriction of the blood vessels within a matter of seconds, and that can also lead to a massive heart attack. So atherothrombosis, atherosclerosis, and coronary spasm are the actual mechanisms. And again, the InterHeart study, the Framingham study, all of them have very nicely, elucidated the actual risk factors for cardiovascular diseases, so for heart attack. So there are several lifestyle reasons which are usually not touched upon. We talk about hypertension, blood pressure, blood sugar, dyslipidemias. We ask about smoking, whether they have alcohol intake. The other things which are not usually touched upon are the mental stress, the diet aspects, the exercise aspects, and of course the BMI or the obesity of the person. Body mass index is the parameter that we take. So all of these 9 risk factors are modifiable risk factors, and each one of them is an individual independent risk factor for coronary artery disease. So once a person has 3 or 4 of these risk factors put together, then the risk of a heart attack really multiplies. So the World Health Organization has come out with this chart that says, just by controlling 4 of these shared risk factors, that is tobacco use, unhealthy diet, physical inactivity, and harmful use of alcohol, we can bring down the morbidity and mortality due to all the 4 major non-communicable diseases like CVD, diabetes, cancer, and chronic lung diseases. So it is not that difficult, but these are lifestyle changes. So if we have to stop smoking, we have to start eating healthy. So we have to also be regular in our exercise and try to avoid alcoholism. So let's look at these in a little bit more detail. Last speaker also pointed out the fact that genetic predisposition is an important thing. Yes, definitely it is. But there is this concept called the epigenetic theory, which in the recent past has shown us that even if somebody has a genetic predisposition and has a family history, if they have a healthy lifestyle, if they're on regular annual checkups and keeping all their parameters under control, these genes may not even manifest in our lifetime. So this is the most important message for all of us, more so for the younger generation, because age, gender, and family history can be overruled by a healthy lifestyle. Please Google it up. Look at the science of epigenetics is evolving very fast. In fact, I did my PhD in cardiogenetics from the Netherlands. So it's a very interesting topic that I worked on. I worked on sudden cardiac death due to single gene disorders, whereas we are talking about heart diseases and cancers, which are multifactorial. A lot of it is to do with your lifestyle. So I think that is the main message of my talk today. I will be touching upon what cardiac and pulmonary rehabilitation are. This is again a relatively new science in this part of the world. Cardiac rehab is a medically supervised program that helps improve the health and well-being of people with heart problems. Together with pharmacotherapy, it can definitely reverse heart disease. It includes exercise, education, nutritional guidance, and stress management to help people return to an active life. And it is indicated in patients who have had a heart attack, coronary artery disease, peripheral arterial disease, any angina, CABG patients, that's bypass surgery, or PCI and angioplasty. The more recent indications, that is earlier we would have not imagined somebody with a heart failure or a cardiomyopathy to be benefited by cardiac rehab, but now we know that all these indications, including heart-lung transplant and even valve procedures, these patients may also benefit from cardiac rehab. It is normally done in 3 or 4 phases. So cardiac rehab, in the first phase, it's typically somebody who is an inpatient just admitted with a cardiac event or a diagnosis, and there it is mostly reassurance and risk factor assessment. The second phase is normally when they recover from their cardiac event. So it's the post-discharge period. Normally it varies depending on what procedure they've had. If it's a bypass surgery, it could be about 3 to 4 weeks. If it is not, if it's more of an interventional procedure, the recovery is very fast within a matter of a day or 2. The third phase is the most important, where we provide the 12-week intensive cardiac rehabilitation. It can be hospital-based. However, it can also be like a rehabilitation center that Cardiac Wellness Institute is. And that 3-month period is very important for providing all these multidisciplinary approaches to provide the holistic wellness for them. And the last phase is the structured follow-up care. After their intensive rehab, they go on into a maintenance program and they're taught how to lead a self-managed healthy life. In fact, during this COVID period, we have completely converted our services into online and home health programs. So people and patients follow their cardiac rehab right from the comfort of their homes, just like how we are doing this Zoom meeting. We have our team providing them, remote advice, but through online supervision, through video calls and so on. So the main role of education and counseling is people who have had cardiac problems. Of course, the cardiologist and the cardiothoracic surgeons take wonderful care, but they do not often have the time because they're at the life-saving end. So they might give some guidelines, but deeper questions like, when can I get back to work? Why am I prescribed so many medicines? What is there for me in the future? Is it going to be a healthy life? What about all the activity and food restrictions? How am I going to get back into my family life? And family members are very anxious. Sometimes the patient is not communicating that much, but it is their spouse or the children who are extremely anxious and have a lot of worries. And of course, they need a lot of scientific, trustworthy information, and the regular contact with the cardiac rehab team in the first few months makes all the difference. They're given so much counseling and follow-up and supervision and care. There are a few patients, like, I just thought I should highlight. We had recently a 45-year-old, male, a corporate executive, who was very fit, a marathoner, in fact, who suddenly, in fact, after a running episode, had a myocardial infarction. Immediately had an angioplasty done. It was a massive occlusion in one of his coronary arteries. He came to us within the first few weeks of his angioplasty. He was extremely happy that he was guided the correct way on how to go about exercising. So somebody with a cardiac problem has to undergo supervised exercise. So he wanted to be back on the track again. He wanted to be running marathons again. And surprisingly, I met him when I did my first 10K marathon last year in the Chennai, marathon. So he was like, "Hi doc, how are you?" So I'm like, "Good. So you're back on the track and running." So that's exactly what we provide. We provide them with the, the confidence, the supervised training. So we had another 55-year-old woman, a homemaker. In fact, she had just turned a grandmother. She had chronic insulin-dependent diabetes mellitus and was morbidly obese. She had undergone her bypass surgery recently and again presented to us for cardiac rehab. So again, for her, the concern was she wanted to be in the US with her daughter's family to take care of the newborn kid. And she was concerned, will she be able to travel after the bypass surgery? What is her health condition going to be like and everything? So again, the rehab was very effective for her. The outcomes were wonderful. She's, I think in the US during this COVID time, she keeps calling us quite often and updating us. And the last patient I thought I should talk about is a 62-year-old man from Kolkata who had, ischemic cardiomyopathy, was in end-stage heart failure, came to Chennai for his heart transplant, and again presented to us for post-heart transplant cardiac rehab. He's doing very well. It's about 1.5 years since his heart transplant now. He even now joins in all of our awareness webinars. So let me play this video on actually what is the type of work we do at our center. Yeah, so that was a short video of actually the flow of work and the kind of primary and secondary prevention programs that we do. We also follow it up with scientific publications. So we had our first publication in 2016 in the British Medical Journal, the Heart Asia Journal. We showed that these multidisciplinary prevention programs are effective in our own population. And we highlighted the fact that these programs, which are developed globally, have to be tailored to meet the sociocultural, psychological, and linguistic needs of our population. And if done in that manner, the outcomes are good, and it can be an effective addition to the existing treatment modalities of coronary heart disease patients. So this is a mandatory part of cardiac disease management in the West, whereas it is just now gaining grounds in India. Again, recently in 2020, we published a multi-center retrospective study on how cardiac rehab facilities across India are faring. So I would really like to thank my collaborators on this from different parts of India. So it is still a evolving and developing branch of cardiovascular disease management. So we again were able to show that there's promise showing out here, but we need to work together to make sure we meet international standards. And briefly about COPD or chronic obstructive pulmonary disease, we know that chronic bronchitis and emphysema are the two most common types. And a typical patient is unable to do several activities of daily living, is quite emaciated and thin, and has a lot of limitations and even oxygen dependency. In fact, the economic burden of COPD in India is grossly underestimated. It is believed to be in 35,000 and odd crores of rupees. So we talk a lot about CVD, cardiovascular diseases, but COPD is quite neglected. The American Thoracic Society defines pulmonary rehab as evidence-based, multidisciplinary, and comprehensive intervention for patients with chronic respiratory diseases who are symptomatic and have decreased daily activities. So typically patients with COPD, persistent asthma, bronchitis, and even other diseases like lung cancer, lung surgeries, lung transplant, all of them are well known to benefit from pulmonary rehab. And the goals are to reduce symptoms, decrease disability, improve the overall quality of life and participation in all activities, and have some economic advantages for the patients as well. And I really need to touch upon the fact of cardiovascular disease and burnout in doctors. So, we all know that doctors are at, it's a stressful profession. And right now in the middle of the COVID-19 pandemic, this has been magnified. This was a study done recently from, of course, I think Vellore in Tamil Nadu, that showed that doctors are at a higher risk compared to nurses and the general population in terms of lifestyle associated risk for cardiovascular diseases. And the concept of physician burnout, that is, people who are in the medical field, the doctors get burnt out, very quickly. This has been well recognized in the West because it has been documented and published, but I'm sure this is a big problem in the developing countries here as well. And the basic issue is there is no balance between work and life. And the doctors are facing several dilemmas, just like our state president and our secretary pointed out. There's several dilemmas during this COVID-19 period. And it's both the psychosocial aspects and the physical stress that people in our field are undergoing. So we need to take care of ourselves. The next few minutes are just going to be some simple tips. So we want to lead a healthy lifestyle. The first important thing is, are we eating healthy? So if you look at this pyramid here, it is a very basic food pyramid, but at the bottom of the food pyramid are naturally available fruits and vegetables. So this should form the predominant bulk of our diet every day. This is then followed by the grains and cereals. So anything that is whole grain is better than polished refined grains. So whole grain examples are brown rice, whole wheat chapatis, whole wheat bread. You have your millets. All of these are examples of whole grains. And of course, then comes our protein products, protein rich foods like dairy, and then we come to our meat and seafood. And up above are the high fat and high salt and high sugary products. And a simple concept called the healthy eating plate was put forward by the Harvard group. So every time we pick up a plate to eat, try to see that half your plate is filled with fruits and vegetables. 1/4 is whole grain products, and the remaining quarter is healthy proteins. So in this way, we will, just like Dr. Pradeep had also highlighted, make sure that we will get the healthy components of the healthy components of the diet. We can add some Nuts, definitely every day we can add some nuts, some vegetable oils in our diet. Like we use oils for cooking, we use oils for garnishing. That's good. Make sure you have low-fat dairy products, preferably low-fat milk, uh, low-fat yogurt, anything which is low-fat, and choose healthy proteins like vegetarian sources or your lean meat, chicken, and limit the red meat. So this is what a healthy every meal of ours should look like. In fact, we recently looked at the prevalence of cardiovascular health risk behaviors in college-going students in our city of Chennai. And the young children between the ages of 18 and 24, just like many of our road tractors are here today, we noticed that their intake of vegetables was not satisfactory. Fruits and whole grains was much below the expected level. They were not exercising adequately. So people who are exercising on 5 or more days per week were very few. They were not getting enough sleep and they were chronically stressed. So all of this, of course, the good thing was the level of tobacco use and alcohol consumption that was self-reported was very low. So we used a questionnaire to assess these health behaviors, but there were lots of scope for improving. So how much time do I have, Dr. Jamuna? Based on that, I could share a 1-minute video or I could go ahead.
Yes, ma'am. I think you can share, ma'am. Please
Okay,
share.
this is a
Lovely
short
information coming up.
Thank you.
Yes.
This is a short video on the workshop we did for those students.
Yes.
World Heart Day is celebrated on 29th September every year. It knows about cardiovascular disease. Dr. Priya, the clinical director of cardiac wellness, has organized a workshop in MOP vascular to raise awareness among young generation of cardiovascular disease.
So that video was just a short, brief video of the workshop that we did. So going ahead with my slides, what about the physical activity levels? Again, as marked here in dark red, in India, we are really falling short of our exercise levels. So physical activity levels as measured in METs per week, that is metabolic equivalents spent per week. The time spent in exercising per week is very, very low. So how do we know if we are exercising enough? So the World Health Organization says that we should at least exercise for 30 minutes. That's moderate to high intensity activity on 5 days a week. So that's 30 minutes into 5 days. That's 150 minutes of brisk aerobic activity per week. Or if you're somebody who likes to do vigorous exercises, it can be on 3 days a week. But whichever type of aerobic exercise you do, it has to be combined with moderate to high intensity muscle strengthening activity on 2 days a week. So this is a requirement for all of us, irrespective of our age and clinical condition. This can be built upon, this can be improved, and it can be advanced. So the basic principle of exercising is the FIT principle. You have to watch out for the frequency, intensity, the time, and the type of exercise. We are all quite aware that how many days a week we exercise. At least if you are exercising 5 days a week, great. Then we can say that you're a regular exerciser. And each time it should be at least 30 minutes. And the type of exercise, each of us has a preference for the type of, different types of exercises like walking, swimming, running, whatever it is. The intensity is something which might not be very straightforward, but it is nothing but the effort that we put into exercise. So how hard or how severe is that bout of exercise is called the intensity. So we have to now think about exercising at home. If we are someone who is used to, outdoor exercising or water activities, right now the situation is such that we can't head out too much. We have to start exercising at home. So this is just a brief video. If you want, you can all do this. You can try this, students. So that was about the exercise part. So what about the mind-heart part of it? So is there a connection between the mind and the heart? Yes. So we all know that, stress is something that we cannot live without. But of course, there's a difference between the stressors and stress. So the pressures or the triggers which come from outside are typically called the stressors or the triggers, and stress is our own response to these external triggers. So once we know the difference between a stressor and a stress, it is easier to understand that stress response is under our control. So the first thing is to recognize that it's okay to not be okay. So it's not necessary that all of the time we have to be, upbeat and positive. It's just absolutely fine to have some negative thoughts or emotions and to be down or having some blues. It's okay. Once we recognize that, acknowledge that, it's easier to take help from our, either from our loved ones or let's say from medical professionals as well. So it is important to manage stress in a healthy way. So quite often you cannot do away with that stress, but it's important to manage it healthily. So I would recommend regular exercise, a healthy diet. And if you're interested or used to, definitely practices like yoga, meditation, deep breathing, all of this brings down our stress levels. It helps to align our mind and body better. And social service, I mean, that's definitely something which a lot of you are in this forum are taking up. I think that's a wonderful way to manage our stress, to connect with the world outside us, and even unleashing our creative potential. Maybe this COVID pandemic in a way has been beneficial because it has given us more time to look inwards and unleash our potential. Again, it's important to spend quality time for yourself and with yourself. That's called the me time. It helps to reflect, relax, recharge. It's considered one of the best things you can gift yourself. A small amount of time every day to do things that which you're passionate about. You all charge your phones, I'm sure, on a daily basis, but are we recharging ourselves is the bigger question. And please do not succumb to addictions like smoking and alcoholism. These may seem to be stress busters, but unfortunately they are not, and they lead to a lot of health problems like coronary artery disease. So I think the message here is managing stress in a healthy way. And sleep. Why are we not getting sufficient sleep? That it could be that there's a vicious cycle going on between the sleep and stress. So when somebody is very stressed, they're not able to sleep much, but even the lack of sleep can increase their stress levels. So try to stick to a sleep regime, try to get at least 6 to 8 hours of good quality sleep every night. Or day, some people are working night shifts, so it doesn't matter which time of the 24 hours, but try to get your 6 to 8 hours of sleep. And also remember that a lot of hormonal imbalances are due to this imbalanced or abnormal sleep cycle. So youngsters also need to be aware of this. And can we start today with smart health goals? Now we know what is needed to lead a heart healthy lifestyle. We just need to set specific, measurable, attainable, relevant, and time-bound goals. So these are called smart health goals. We could discuss more about it if we have time, but you can also Google it up. So it is a SMART goal is a general, tool they use across all genres, across all professions, and we use it for our own, patients to modify their health-related behaviors. So the take-home message is very simple: lifestyle, environment, genes, all of this are, playing a contributing role in cardiovascular diseases and lifestyle diseases. These are global burdens, no doubt. We, the healthcare professionals, are definitely at a higher risk. We know that prevention is the best approach. We need to just take efforts to, pay attention to the prevention part. And of course, cardiopulmonary rehabilitation is now becoming more and more available. We have to ask for it for ourselves and for our patients. So this is my email address. Our website is cardiacwellnessinstitute.com. If any students or anybody would like to reach out to me for further information, I'll be more than glad to share the information. And thank you very much once again to all the organizers. And I think, I should take this opportunity to thank my team members at Cardiac Wellness Institute. Without them, all this work would not be possible. And thank you to my, my teachers, my professors, and my family as well. Thank you for the patient listening.
Thank you. Thank you, Priya.
Thank you for the clear and distinct message conveyed, Doctor. I'm sure it will be beneficial for many. Thank you. Now the floor is open for questions. Please type your questions in the chat box, and our President, Rotractor Bino Sherwin of Savita Medical College, will take over now.
Okay, thank you,
So,
ma'am,
Bino,
and
there's
thank
a
you,
first
sir.
question there.
Yeah, thank you, ma'am, and thank you, sir. It was very informative. Now for the question and answer sessions. The first question put down by Dr. Shruti, ma'am. Ma'am, can I answer yourself, ma'am?
Not audible, Pa.
Hello?
Clear.
You had a break, Binu. So repeat the question. You had a break, Binu. So just read out the question again, son.
Ma'am, 1 second.
Yeah.
Okay, the first question. How resilient are the patients and family members to cardiac care in India? And second, in the same question, do you find more resistance in comparison to those abroad?
Yes, when I think they mean to ask what is the resistance. I'm not sure what exactly they mean to ask, but compared to the Western population, yes, we are more susceptible to cardiac problems. But when it comes to cardiac care, we are on par with the rest of the world. So the emergency cardiac care, the life-saving procedures are just on par with any other part of the world. So in India, we are not lagging behind in the quality of cardiac care that we give. But are they resisting lifestyle change? Are they, resisting medication? So these kind of things, it's difficult to answer as in a simple answer. But yes, most of them are taking up these management protocols, are following our advice if they are sufficiently convinced that it is important for them. Yes, if it is life-saving, they will not doubt, they will not think twice, they will definitely go for it. But when we talk about more cardiopulmonary rehab and then the longer term benefits of lifestyle changes and things like that, that is something which, they need a lot of awareness about. So I think that is why we build in the awareness creation as part of the overall prevention program. So unless they are convinced, unless they see what is happening, benefits of these kind of multidisciplinary and holistic programs, once they understand it, they don't drop off the charts. So we have patients who have adhered to these for more than now 6 years. That's 6 years since we started our program, right? So it is something that we need to educate them and counsel them about. And once they see their experience the benefits themselves, they don't get repeated hospitalizations. They don't have too many complications. They're actually doing very well in terms of exercise capacity and quality of life. And then there's no looking back. They get convinced that this is the way to go forward.
Yeah, students, you can start asking your questions, please, in the chat.
Or if you want to ask, you can unmute your mic and also ask.
Yeah, but then not everybody together, right? So, yeah. Any questions from Savita and Stanley? Doctors are here for you. It's open to all. Anyone can ask questions.
Dr. Priya, I just want to know.
Yes,
say, even if they go before any surgery, do you give any do you give any management for the patients who are having breathlessness and asthmatic conditions?
Yes.
Like that.
So we have what is known as prehabilitation. So we talked about rehabilitation, but prehabilitation is something which happens for patients who are posted for surgery. Let's say they have heart failure, or they have chronic lung disease. They're posted for surgery. Even patients posted for transplant, they have to be on the waiting list. They can only undergo their transplant procedure when the organ becomes available. So for all of these individuals, even for patients, cardiac patients on device therapy, so ventricular assist devices and ICDs. So for all of them, cardiac rehab or pulmonary rehab has been recommended because it is beneficial. Their post-surgical recovery and their long-term outcomes are much better if they start early. I'm sure Dr. Pradeep Nair would also, talk about that. Dr. Pradeep?
Priya, yeah, it's like this, but we mostly rely on drugs compared to your approach, and most of the complaints can be managed with drugs till the surgery. So we manage with the thing. If patient is failure and having breathlessness, diuretics and all that. If patient is a COPD, then accordingly bronchodilators and other respiratory support systems.
Definitely, Dr. Pradeep. No, pharmacotherapy is something which is definitely not doubted here. But on top of that, if we could, optimize their lifestyle and start getting their functional capacity up to level before surgery, then it's shown that the outcomes are better. So that was what I was trying to highlight.
I just want to know what type of measurements you are giving. In what way you are giving, in the form of exercise along with the drugs? Or,
right. Yeah. In the form of exercise. So when we talked about, you saw that video, so we give them a supervised exercise regime of, let's say 12 weeks, about 3 months. They undergo all the training in terms of aerobic exercises, strength training, balance exercises, flexibility. It's personalized. So we evaluate their exercise capacity either through the treadmill test or the 6-minute walk test at the initial part of their evaluation, and based on the individual patient's clinical situation. They are prescribed exercises in a particular format, and we also counsel them about the need for adherence to medications. So if they don't adhere to medications, all of this might not be beneficial to them, will not be of any use. So they have to adhere to each and every medication prescribed to them and try to follow these recommended lifestyle changes in terms of diet, exercise, psychosocial stress management. All of this combined together leads to a very good outcome in terms of prevention of complications in cardiac and pulmonary patients, more so in cardiac patients.
Thank you. And what is your suggestion for patients who are having osteoporosis? It is not for you. I just want to know.
Yes, osteoporosis is something which can be prevented. Yeah, it can be age related. Of course, women after their menopause, face osteoporosis quite a lot. But bone strength is quite dependent on the exercise levels. So that's why we say from a younger age, it's ideal to start exercising regularly. That is beneficial and proven to prevent osteoporosis. So if somebody has osteoporosis, they have to stabilize and then start with their gradual exercises, non-weight bearing exercises, and then they can, once it is safe, they can also start to do all their weight bearing exercises.
Anyone else?
I am Dr. Chockalingam Jamuna.
Yes, sir.
I really appreciate Pradeep and Priya for the excellent talk, Pradeep, Chockalingam. They are my students, but they are excelling Chockalingam. I am so proud about you, Pradeep.
No, please.
Your presentation is so nice. And Jamuna,
Yes,
nice
sir.
of that. Jamuna, the way in which you are smiling all the time, please be very clear, your heart will work for 100 years. So please keep smiling, be happy all the time.
Thank
No
you,
need
sir.
to come to any cardiologist. Why I'm telling that, Pradeep, Priya, many will ask me, whatever thing they are telling you should be continued lifelong. Definitely, because if you want long life, it should be continued lifelong. And the younger generation, I always tell them, please avoid hurry, worry, curry to get buried.
Wow.
So all the time be happy. Nothing should compromise happiness. Another important point Pradeep highlighted very nicely. I will ask one question for the audience. Suguna, you also can. Those who are unmuted, please answer my question. Which nuts contains maximum cholesterol? Kavya, Suguna, Meenakshi, which nuts contains maximum cholesterol?
Cashew?
Yes. He shows, Suguna, you didn't listen Pradeep Nair clearly.
Oh, no, he said it a little amount is okay.
Oh, please be very clear, my dear friends.
Okay.
All vegetable sources are zero cholesterol. So all nuts are all zero cholesterol. Please take nuts in smaller amount, the skin of it, not adding ghee and other thing like that. So no nuts contains cholesterol, Suguna.
Thank you, sir. That was nice.
And another thing, Pradeep, you have put it so nicely. Priya, your excellent way of expression of things. Only one point I would like to add to that. Now, if someone is having a 90% block today, it's not necessary that everyone should go for stenting or bypass surgery. If everyone follows what Pradeep and Priya Chockalingam tells, and if you follow honestly, that block regresses by 1 year, it may even totally disappear. So regression of block by lifestyle modification, happiness. Another thing they coined Pradeep so nicely, and Priya also told, that epigenes are phenotypes that carries the diseases that also will get modified by 10 years of positive thinking and positive lifestyle. The diseases that are carried by your genes or phenotype epigenes, they get disappeared. They are not permanent diseases. Please communicate this message to the younger generation. That's what I used to say. நேற்று என்பது உடைந்த பானை, நாளை என்பது மதில் மீது இருக்கின்ற பூனை, இன்று இருப்பதுதான் கையில் இருக்கின்ற வீணை என்று ரசித்து வாழ கற்றுக்கொண்டால் எந்த வியாதியும் வராது. I am so happy. I really once again appreciate Jamuna, Suguna and everyone. Pradeep, your wonderful presentation. Priya, I really appreciate. Please continue your journey. Today I am completing 52 years in cardiology and I am now seeing 4th generation of students. I am so happy and proud. And Pradeep and Priya, you must create your own students in generations to come. My best wishes to everyone.
Thank you. Good evening, sir. Dr. Chockalingam, Dr. Rotarian Renuka Ramakrishnan here.
Oh,
How are you, sir?
எங்கம்மா இருக்கீங்க தெரியலையம்மா.
Nephrologist. I'm not on video call, sir.
Okay.
We've
Thank
come
you.
for many, we have met many times. And congratulations and thank you so much for joining us, sir.
Definitely. Jamana was telling, I told her after 2 or 3 months, I will give a talk, because if I give a talk immediately after Pradeep and Priya Chockalingam, they won't appreciate my talk.
We are here to listen. All of us
like
are here
that,
to
sir.
listen to you, sir.
Thank you. Very nice.
Thank you so much, sir. Thank you so much.
I appreciate Pradeep, Priya.
Thank you.
Thank you so much.
I thank you, Dr. Pradeep Nair and Dr. Priya Chockalingam for the wonderful session. Now over to Suguna.
Yes, ma'am.
Yes,
I
good.
think there is just one more. I think one more question by
Final
Rotractor
two questions.
Meenakshi. How should we decide on what to do after the MBBS? On this line, yeah.
Thank you, Dr. Meenakshi. You did a great job of, facilitating the program today. So I think it mostly depends on, in my opinion, what is of interest to you. So if your interest, where your interest lies, in which field is one thing, and the other thing you have to look for is what is an evolving upcoming field. Again, the fundamental would be your interest. Are you inclining towards the medical side, the surgical side? For me, preventive cardiology is a passion. So, I did my medicine, then went on to do pediatrics, and then moved into preventive cardiology. And I realized that's where my heart is. So it's a challenging field. It's an upcoming field. It's definitely not a bed of roses, but it's something which I'm feeling very grateful for. It's a rewarding experience to be making difference to the lives of people who otherwise would succumb to these diseases very easily. So try to find what is of most interest to you. And of course, as the IMA president and secretary said, the seniors are around. So there's this association, there are these people in different fields whom you can easily approach and get their feedback and, enter into the most appropriate field for you.
Meenakshi, don't take up the specialty because somebody tells you, as Priya was telling, your mind must decide what you want. One. To any specialty you can take up, you must involve in that, you will excel. But youngsters like you, the future will be very enormous in bioengineering, biotechnology, with the medical or genetic one, anything you can take up. But first of all, you must go into the COVID itself, find out the vaccine for that, Meenakshi. You will succeed in finding the vaccine. Elders may not be in a position to. Anyway, I really appreciate. Thank you.
Thank you, doctor.
Doctor, there's one more question from Rotractor Kavya Kamaraj. At what age should a person start visiting a cardiologist as a regular checkup?
Yes, the recommended age is 40. So at least till now, it was said that everybody above the age of 40 should get their regular checkup done. That's their blood tests, to look at their lipid levels, their sugar, their BP, and also get their ECG and echo done every year after the age of 40. But recent recommendation by the American Heart Association is to get tested for the first time at the age of 20 for modifiable risk factors or your lifestyle risk factors. And after that, if everything is normal, once in 5 years, and after the age of 40 every year. So this is also an evolving recommendation. So at the age of 20, I think right now, most of you should already know what your 9 risk factors are, where we stand, and how do we move ahead with minimizing our risk of these diseases. I also see one question: have there been any programs designed at the level of school in the lines of preventive cardiology in India or abroad? For school children, there's nothing that I know of that is structured or formal for school children, but we, preventive cardiology units focused on primordial prevention are already addressing school children from middle school year upwards. So I think at the age of 12 to 13 and upwards, they are able to absorb and understand all of this information. In fact, they ask very pertinent, relevant questions that we as doctors or professionals are not able to answer. So it's happening, but still not in a very structured manner. But I think we have to make efforts to do that even at that young age, because that's when primordial prevention should ideally start.
And Jamuna, that block in the vessels, you know, at what age it starts? Anyone can guess at what age that block starts? From what age?
Right after birth?
Yes, exactly. But really it forms from the age of 3 years.
Okay.
And as I've been telling, never advise your children. You please be a model for the children. You behave in such a way, they will learn from you. You will do all the negative things and the instructing the children, they will never follow that. So you must become a model for the children. And Priya said, primordial prevention is the most important thing. It must be taken once they cross the age of 10 years of age, male and female children, school children, they can understand, they can implement it. Once they implement from the childhood at the age of 15, then they can live up to 100 years. So as she stressed, it must be from the very beginning. Really appreciate.
You have to unmute yourself, Subhana.
Yes, yes. If there are no further questions, I think over to you, Meenu.
So thank you. We often take things for granted, but the two words "thank you" make a world of a difference. I call upon our secretary, Protractor Niranjana of Savita Medical College, to deliver the formal vote of thanks.
Thank you, Meenakshi. I take immense pleasure in delivering vote of thanks. It was an enlightening and interesting evening. All the speakers and faculty had lots of knowledge to share. No one who achieves success does so without acknowledging the help of others. With these words, it is time to express our heartfelt thanks to all the senior doctors, our speaker for the day, Dr. Pradeep G. Nair, and Dr. Priya Chockalingam, IMA faculty, and our faculty advisor, Dr. Shruti Ma'am. We would like to express our gratitude to Rotary Club of Chennai Bharati for having put together with an enlightening evening. A special mention to Rotarian Suguna Devi and Honorary Secretary Dr. Jamuna for all the efforts they have taken to bring out this lovely program today. I thank all the participants and Rotaractors of Stanley Medical College and Savita Medical College for making this event a grand success. Thank you all.
Thank you.
Thank you.
Thank you, Rotaractor Niranjana.
Yeah, that was nice. I think we should specially thank all the doctors who are here and also Dr. Chockalingam for now and then giving us a lot of inputs. Thank you, Doctor. And thank you, Dr. Pradeep, and Dr. Ravi Kumar was also here. He encouraged us. Dr. Ravi Kumar came for the first meeting also. And the very first thing he said, I'm a Rotarian. And I asked him, sir, I'm the youth service this year for my club. Can we do some knowledge sharing? He said, yeah, fantastic. Yes, we can go ahead and do. So I'm so happy that Dr. Jamuna is with us, and she's been supporting our club with a lot of programs like this. And thank you, Dr. Renuka Ramakrishnan, who actually introduced our club to IMA. Thank you so much.
Thank you, Rotarian Suguna.
Thank you. I invite our Finance Secretary, Dr. C.S. Setty, for vote of thanks.
Yeah, accept.
C.S. Setty.
Jamuna ma'am.
Setty sir irukara? Madam Setty sir irukara?
இருக்கமா
Sir,
இருக்கேன். I don't want to repeat what Dr. Niranjana said, thanking everybody, each one of you. I don't want to repeat it and go on saying thank you to everyone. But it was a wonderful talk by both of them, Dr. Pradeep Nair and Dr. Priya Chockalingam. One is on the rehabilitation side, which is was little known a few years ago, and now it has become a part of the treatment. And I have to thank our IMA President, Dr. Raja, and Dr. Ravi Kumar for participating, and all the Rotarians, Rotracs, and Thanks to all the people behind the screen. Thank you very much.
Yeah, thank you, Dr. Priya. That was really nice. A lot of info we got. I think children are benefited on this. So we
Thank you.
request, yeah, yes.
Thank you very much. Really appreciate it. Really enjoyed the session with all of you.
Yes.
And please ask the students to reach out to me, reach out to us if they have any questions. We'll be more than glad to address them in person as well.
So nice of you, ma'am.
Thank you. Thanks. All the
Thank
best.
you all. I have stopped the live FB.